Right now, look, we're in South Louisiana. Anyone who's got allergies, take this.
NAD is probably the biggest thing coming out right now on anti-aging. Normally, like when we're tight in here and you start getting that pressure and you're taking those joints and muscles through full range, this one feels almost addicting.
So consistency over intensity. And then we're just going to roll up and down. It seems crazy, but when you go get massages and they're finding tightness in here, the first thing you need to do is start releasing this stuff. Kelly, thank you. You did the exercises last week and it helped a lot. Good day, my friends. Happy Wednesday. How's everybody doing? We are back. I was at a conference in Las Vegas until a few hours ago. Got back, saw some patients. And I'm here with you, beautiful people. So please drop me a line, say hi. I do this every month. We call this Tea with Dr. D. This started way back in 2020. This was kind of a COVID start, but where we would have T answer whatever questions you have about health, supplements, healing, regenerative therapy, pain, anything you got. I'm here for you. Whatever questions that jump out, let me know. Please drop me a line, say hi. These are always weird because you're talking like, to yourself. So I love the interaction, saying what's up. It definitely makes it a little bit easier to know that there's people in the social web. Yes, you can text us. Please let me know that y'all can hear me also. 801-691-7582 is our text platform. That's for simple question and answers. Whatever questions you got, I'll answer them. That comes to me. Those are come to my phone whenever we get it. So, hey Heather, how are you? Thank you so much for joining us. Let me know if y'all have any questions. I know we have a few people who sent some text messages in before we got started. You can hear beautiful. That's a good start. Awesome. If y'all have any questions, anyone joining us, let me know. But we are going to start with some of the, let's call them VIP questions, people who sent them in ahead of time, and we'll get things rolling. On Tea with Dr. D. I missed the regenerative therapy workshop. Can I get a recording? I think we got a bunch of these. So Al pulled the one. So if you missed, we had a fantastic regenerative therapy workshop. What was that? Let's say a week ago now, roughly, right at a week ago. Very good. We have the recording, but even more than the recording, we have some of the notes from that workshop. So if you're listening to this and you want that, if you shoot me a DM and just put like regenerative therapy workshop, I'll send you everything from that will include the notes from it, will include the protocols that we have in there, some of the tips and tricks around regenerative therapy, and we'll get the recording over to you. So if you missed the workshop, don't miss it next time. There's some good stuff that happens. You got to be there for them. But if you did miss the workshop, shoot me a DM, and we'll get you everything. We'll get you recordings. We'll get you the notes for all of that stuff. Once we kind of get everything edited, we'll probably put a little bit of that out. But in that one thing, you're going to have to send a message for us to send it over to you. So if you missed it, let us know. We talked a lot about the future of peptides. I think they will change the game of healing. We talked a lot about how our body heals initially in this like weak scar tissue model, and how we're trying to change that to healthy or native like tissue. And that's what our whole regenerative therapy program does, is like, can we regenerate healthy tissue so that you don't need surgery, you're not in pain, your tissues are healthy, your cells are healthy. We talked about how you can use regenerative therapy for brain health, for gut health. There's some really exciting things that we're doing in that space, and the research is matching it. So yeah, shoot me a message and I'll get you everything from that workshop. So you can get that, is my answer. Would regenerative therapy do what what would regenerative therapy do for damaged cartilage or arthritis? So we definitely, hey Billy, how are you, man? We definitely got a bunch of questions about how regenerative therapy could help with joints. And there's quite a bit of studies done on cartilage inflammation and fluid motion. In mild to moderate arthritis, there's some stuff that we can do. I'm not going to like come on here and tell you like, oh, if you've got terrible OA, osteoarthritis, that you're going to regrow all that cartilage. Even we don't even see that in stem cells right now. But what we do know is that you can reduce the inflammation, you can improve the fluid retention in the joint, and we can basically stop that arthritis from getting worse if we do the right thing. So it will definitely help damage cartilage. It'll definitely help the inflammation and the pain from arthritis. So if our end goal is to feel good, is to move better, is to feel healthier, that's where regenerative therapy will help a ton with cartilage issues. We did a study on cartilage damage in knees, and within the first month, this was supposed to be a 3-month study. Within the first month, everyone had maxed out their questionnaire improvement. So they were like, I have no pain. I'm moving. I'm going up and down stairs. I feel fantastic. So love it. It just blew everybody away. We thought there'd be improvements. We just didn't think that it would be that deep. So those were in arthritic cases. So very impressive of what we see when you combine, you know, the regenerative peptides with the right treatment, with the right technology. Powerful, really, really powerful. Great question. Is there anything I can do to make regenerative therapy more successful? Absolutely. I think this is a very common question, like, what do I do during this time to make this better? And if you're going through a regenerative protocol, we give people a lot of kind of directions of what they should do there. And whenever you're looking at that, everything that makes you healthier is going to make regenerative therapy better. So sleep, super important. Your body builds tissue and repairs, replenishes your energy while you sleep. You've got to sleep well when you're doing regenerative therapy. We've got to get away from anything that causes stress or inflammation. So whenever we're doing regenerative therapy, we're like, no nicotine, back off of alcohol, let's back off of sugar. All of those things create inflammation, and they're gonna reduce your ability to regenerate healthy tissue. I'll tell y'all now, we label our months, and the month of July is going to be sleep and recovery month at Acadiana Pain. And so we're going to talk a lot about sleep and how to improve sleep and what that looks like, and how much that changes every area of your health. You can do all the right things health-wise, including get regenerative therapy, and that's going to get you on the right track and get you feeling better. But we've got to use that momentum to start making deeper changes. We've got to use those improvements to start sleeping better and exercising and improving our energy and improving our diet and improving our movement and our exercise. We've got to use that momentum to build. And so when we look at it, we often start with sleep because you can do all of the other things right. And if you're sleeping bad, y'all all know this, you still feel terrible. So what we do is we teach something called SLEEP. And SLEEP is an acronym. So I'm going to teach all this acronym real quick while we're talking about it. So the S in SLEEP, I want you to remember schedule. So sticking to a sleep schedule, even on the weekends of when you go to bed, is so important. What we find is that people get that big chunk of deep sleep early in the night if we go to sleep at the same time or roughly within the same hour, night after night after night. So that means we want to get to sleep at the same time. Even if we had to shorten our sleep, ideally what we would do is we would still go to sleep at the same time, and we would shorten our sleep on the back end. That means we're still getting all of that replenishing, physical, re-energizing deep sleep early in the night, and then we're losing some of the REM and kind of light wave sleep. There's still issues, don't do that very often, but I'm just saying that's how important a schedule is whenever we're looking at sleep, is that it really will change it. The L in sleep is going to be lights. About 2 hours before you start to go to bed, we need to lower the lights down. And so for everybody, we talk about blue lights, and blue light, like if you need to be on a device, yes, wear blue light blocking glasses. It'll help you sleep. I feel a difference if I have to, like, work on a computer or something at night. I'll wear blue light blocking glasses, but in general, the couple hours before you go to bed, lower all of the lights in your house and just turn lamps on. I promise you'll start to get tired like at the right time. So if you're trying to go to bed at 10 o'clock, at 8 o'clock, turn all like the overhead lights off and just turn lamps on. And you'll see a big difference in like your ability to start getting tired. The E is environment, and what we're talking about there is like the changes in your sleep environment. So a lot of times we start with temperature there. The studies show that you sleep the best between like 63 and 67 degrees. That is much colder than what most people put their temperature on whenever they go to bed. We use something called a chili pad. If you don't have one, I'm telling you, it's like the best investment we've ever made for our sleep. You can set the temperature of your actual mattress topper and it is glorious. So I set mine at like 65 and I sleep fantastic. It's like if you've ever gotten in your bed during the winter and the sheets are like cozy and you cover it up, that's what having a chili pad is, and it stays like that all night. I love it. But sleep colder. So the first E is environment. The second E is enhancements. We use a few things to sleep really good and get the most recovery when you sleep. The first one I'm going to tell you is glutathione. If you're not taking glutathione, it's your master antioxidant. Start taking a dose of that before bed and you will feel massive changes. Even if I get less sleep, if I go to sleep at the right time, I'm sleeping, lowering the lights, I still like set that cold environment and I take glutathione. Even if I only get like 5 hours of sleep, last night we were traveling today, I still feel great. And so like that's a really big thing. If you can kind of use some of these programs to like maximize the amount of time you are sleeping. And I know when people are in pain, they're not always getting the length of time we want, but let's get quality in that time if we can. Another enhancement is magnesium. Love magnesium before bed. It helps relax the muscles, really good for your brain, really good for your nervous system. So we use something called upgraded magnesium. It's a liquid form that goes straight into your cells. Love it. If you're not taking that one, magnesium glycinate, really good. Magnesium threonate, really good. Both of those can help. Play with one. The other thing I'll say on enhancements is I'm not the biggest fan of melatonin. There's something called apigenin. It is an extract of chamomile. I've had more patients tell me that thing, man, that really improved my sleep quite a bit. And then the last one, the P in our sleep acronym is pause. Before bed, especially if you're one of those people who like lays there and thinks, I think pause, and I journal whenever I'm in this. So pause and reflect. Just write down whatever you're thinking about, whatever you're worried about, whatever you need to remember. You're like, oh, I need to remember to do that. If you just do this like kind of dump journaling, get it all out, your brain is like, okay, I don't need to take this energy to hold on to that information. I'm going to just let it go. And you'll like relax and fall into deep sleep much better, that you're not using some of this brain space to try and remember or hold on to these things. So sleep, schedule, light, environment, enhance, and then pause. And if you do that, you will start sleeping better and recovering better and giving your body more energy so that you can make regenerative therapy more successful. It's a great start to this whole like energizing process, regenerating healthy tissue, and just regenerating health in general. Start with sleep. It will make such a big difference. So I hope that helps. Start there though. Hydrate too. I would say hydrate if I'm answering that. Do we recommend a certain pillow or mattress? Tough, right? Depending on how you sleep, what position you sleep in. For pillows, if you're a side sleeper, I love the water pillows. That's like the bottom is water, so it can kind of move to dissipate your pressure. And then it's got a really good high quality foam that floats on the water. So this is very adaptable, and you can change how much water you put in. So if I sleep on my side, I'm trying to fill the space from my shoulder to my neck. That's different for me. That's different for Sarah. That's different for you. We all have a slightly different space. You fill the water to your space. So if you're a smaller person, you're going to probably have less water. Bigger person, you'll have more water, but it's adaptable. I do like those. If you look up cervical pillows, there's those pillows that have like little wings on them. Those have been really good for side sleepers. I don't like stomach sleeping. If you sleep on your stomach, try and start changing that. Mattresses, if you have back pain, this is kind of controversial. I find more people need a softer mattress. I know like this is personal preference, but I've had more of my patients who went to like either a softer overall mattress or like what we have here is a hybrid where it's firm. The coils are firm. It's these modern coils. I think we have a Black Beauty Rest is what the mattress is. Love it. It's amazing. You do that and you add your chili pad on top. Thank me. But the top is very soft. And so like when you lay in it, you're not getting joint pressure. You're not getting compression in there. So our simple test for this is like if you're shopping for a mattress, lay on your back. Yes, go in, lay down, legs out. I know you don't sleep in that position, but legs out straight, lay there. And if within about 5 or 10 minutes you feel like you're getting pressure in your low back and you need to bend your knees or you need to like kick a leg out, that mattress is too firm. You're actually putting your back into some extension. So I would go softer than whatever that is. So really individual, have a fast trigger on changing it out. If you get a new pillow or mattress, you should see improvements in your sleep scores. Make sure you're tracking your sleep. Get an Oura ring so you can make decisions based off of metrics, not I think I feel okay. Most people who aren't tracking their sleep, they wake up and they're like, oh, do I feel better? Did I have a good night's sleep? We don't know. I mean, you'll wake up and you'll feel refreshed. But I woke up and I felt refreshed this morning, and I know I slept 5 hours last night because we had to travel fairly early. So, your body will trick you based on a lot of factors there. Track it as you do this. And what we would say is track it. If you change a pillow, within about 2 weeks, we should see some improvements in sleep scores. If you change a mattress, same thing. We should see improvements in sleep scores. If not, call them, make them switch it out. They all have some version of a 90-day policy or 100-night sleep, whatever it is. Use it if it's not improving your sleep or your pain. So I like the water pillow. I like the cervical pillows. Mattresses, I do like the Black Beauty Rest hybrids. The all foam mattresses kind of have like something missing. It's like you lay on them and it's like they feel comfortable, but there's some support that's missing. Probably great if it's like a college kid going somewhere, or you're young and you don't have any pressure points in the back. Yeah, maybe they can get one of those bed in the boxes. But I think if you're over 40, I think you probably need like a modern coil mattress. So sorry if you're asking that question and you're over 40. Awesome. What else we got, Al? Have low energy most of the time. Is that sleep or is that something else? This is a good question. I think whenever people come to us with low energy, we probably start with sleep. I would dig deeper. I mean, when you're looking at energy production, there's a lot in there, right? There's hormones. What we would start with is probably wanting to look at a full panel. So we would want to look at some version of like a hormone panel and a SpectraCell panel, like a micronutrient panel, to tell us, is your body in balance? Do you have the things that make the building blocks of energy production in your body? And some of that is hormone production. So I think with those two things, you would get a really good answer. I would do a SpectraCell test if you're having low energy. That's going to tell us all your micronutrients. I would do a hormone test. These are blood tests. You can get them done any lab now. Hit me up, shoot me a message if you have questions about that. But we would start there. Let's see if your body has the stuff it needs to produce energy, and then make some decisions. While you're doing that test, absolutely go back and do the sleep method. Make sure you're getting on a better schedule. One thing I missed on that is like that schedule. Yes, it starts 2 hours before bed, but also it starts in the morning. If you wake up at a scheduled time and get in the sun, you're going to set a really good circadian rhythm. So I always try to tell people to get in the sun for about 15 or 20 minutes sometime in the morning, like early morning. And that really sets a nice circadian rhythm for people. So that would be my answer to that. It could be that you're not sleeping. Start tracking your sleep would be another thing. Let's start finding out where you're at. Track your sleep, get a SpectraCell test, get a hormone test, and we'll have some really good answers to that. Hopefully that makes sense. What y'all got? Y'all got questions? I think some of those were the early responders, as we'll call them. For the month of July, we're focusing on sleep. We're focusing on recovery. A lot of that sets the tone for us building like strong health foundations and really building blocks, the foundations of health that keep us healthy. I think when we use something like regenerative therapy to get healthy, we want to start using that to build really solid foundations of health that keep us that way, that keep us out of inflammation, that keep us out of joint degradation. So we're working on movement, we're working on recovery, and that really does set us up for a very energized and healthy life so that we can achieve what we want. Our goal in our office is to help everyone in Acadiana that we can find hope, experience healing, and live healthy. And I think some of the education part of the live healthy, how do I keep doing the right things? What do I eat? How do I move better? What things am I missing that maybe I'm not seeing? This is probably where testing and stuff like that comes in. One of the things we do for people is like, we call it a full, like it's a physical assessment on steroids, where it's like, how is your whole body moving? Where do we have restrictions that you don't know about? Where do we have muscle imbalances that you don't know about? And how do we start creating a program physically to actually get you healthier? And so that kind of feeds into this whole, like, recovery process. The one thing that I'll mention on that is something called HRV. As we're going through this, we're often teaching people certainly movement. We're teaching them stretches. We're teaching them the right exercise to make their body healthier. But we teach them about HRV and tracking. HRV is heart rate variability. As we're talking about recovery in July, y'all are going to hear more about that. Your heart rate isn't perfect. It actually varies between beats, and it's supposed to. And if we track that, we'll know how recovered is your body. When your heart gets stressed, it gets very rigid, and it's like the variability is not high. The more relaxed we are, the more recovered we are, our body's like, I got this. And it'll like kind of change the length of time in between beats. And that's a good thing. That tells us your body is recovered really well. And that'll be one of the leading indicators when things are going well, is our heart rate variability goes up. So a lot of times, if we have people who are tracking things well and we're making changes for sleep, let's say, our recovery, we add in, some form of treatment or supplementation, I want to see that their heart rate variability is going up. If you have an Oura Ring, it'll track that. A lot of the smart watches will track that. So it's a really good leading indicator of, are you on the right track? Going back to like a pillow change or a mattress change, I would expect, if somebody's body is starting to get better recovery, for their heart rate variability to go up along with sleep scores. If they start eating healthier, making dietary changes, exercising different, we would also start to see those improvements in something like heart rate variability. So hopefully that makes some sense to everyone. If we don't have any further questions, if y'all have any at any point in time, you can always shoot us a text message. You can call our office. They'll pass that on to one of the doctors, and I promise they'll give you a call back and like have a conversation with you. Anything that we can answer or help you out with, we will. That's why I do these things every month, so we can answer questions and get some good information out. There's a lot of bad information on the internet. We try and bring some science and some actual data into these conversations. You don't always get that with your kind of talking heads on the social medias. But if you do have any questions, shoot us a message, call the office, 337-504-5144. If it needs to go up the chain and they need a doctor to give you a call back, they will. We'll pass that along. You can go to acadianapain.com. We've got a ton of information on there. We've got some really good blog posts and all of the good stuff. So thank y'all for joining me for another Tea with Dr. D. Please say hi, share this with somebody if they're starting to work on health. Rebuilding your health foundations can sometimes feel like a very daunting task. I promise we see it. You have hope. You can make consistent improvements. It's all about just finding those little things that aggregate, make a little improvement in your sleep, make a little improvement in your diet, make a little improvement in your movement. And the aggregation, if y'all have heard of the aggregation of marginal gains, I love it. The aggregation of those tiny changes done consistently grows and grows and grows. And next thing you know, you've lost weight or you've built muscle and you are healthy. So I promise it's doable. You can get there. Have a great night, everybody, and have a little tea. Get you a little chaga tea tonight. I will be doing my nighttime tea. I don't have tea. I know it's Tea with Dr. D, and I don't have my tea on me yet, but I promise I'll be drinking some chaga with a little bit of honey, some apple cider vinegar in there. I can get you, Heather. I'll get it in there. If you have mild to moderate inference supraspinatus tendinosis, is surgery needed? I would say mild to moderate, it should not be. If it's supraspinatus and infraspinatus, then you should be able to get that healthy. I mean, our typical rule, what we have seen in the clinic has been about 50%. The studies say as long as you have like 30% intact, I think that's a bit much. It starts to get a little squirrely if we get less than that. But let's say there's 50% that's still intact of the tendon, and we can measure that, right? You could do an ultrasound image in the office and we can measure how much is attached on the good side, how much is attached on the bad side, what's the thickness there. Here's what the tear would look like, or the tendinosis or tendinopathy. Depending on how much swollen that tendon is. If it's just a tendinopathy, then in those cases, surgery is not usually necessary. Now, I would say in those cases, I think regenerative therapy is probably the thing. It's not usually one of the things that like time is just going to help heal. Usually there's something that has caused the tendinopathy, and we need to resolve some of that. The inflammation at the tendon, we need to make sure that it's not continuing to be compressed or irritated. But I've seen really good results with the regenerative therapy in certainly rotator cuff tendons. I mean, we've seen supraspinatus go from probably 50 or 60% to like 95% healed. We've seen teres minor go from about 40% still intact, 60% torn, to like 90+% intact and doing full pull-ups and throwing and all of that stuff. Pec tear, we've seen go from about 50% to 80% regrowth. And we're measuring that now that we're measuring how much tissue is growing. Most people aren't going to do that when they do stem cells. They're like, a lot of times, like, we don't want to see the tissue because we don't want you to do it. In almost all of these cases, in a very short period of time, people feel very big improvements in their pain and their motion, which is great. I want that, but I also want to get to the point where I know that the tissue is resilient. So I want somebody to feel good, but I also want to be able to look at the tissue and tell them, look, you can go and start stressing that tissue. Look, I know this. I've injured my shoulder more times, and I'm like kind of keep getting where I'm like, I don't have any pain, everything feels good, but I know if I don't get that tissue all the way healthy, I'll be at a deer stand or something, I'll be trying to pull a bow back and I'll like, mess something up in there. So when we're working with patients, I want the subjective. I want you to feel awesome. I want people to get pain better and start getting stronger. But I also want to add in the like, let's look at the tissue and see how much tissue has grown in there, how much of it is regenerating, so we know how fast to push. A lot of what we say, y'all will see, I'm not a big guesser. I don't like to be like, oh yeah, go start exercising it more. Let's look at the tissue. Hey, now we're at 70% or 80% normal. Now let's start adding in some stressors. and start kind of doing some eccentrics and training it to make that tissue pliable and strong and resilient so there is no re-injury. So hopefully that helps, Heather. Thank you for the question. I love it. I very much appreciate y'all spending some time with us this evening and answering questions, sending questions. Everybody who texts me, y'all know this. I love digging into these things and researching and nerding out on all of it. So if we don't know the answer, sometimes we'll tell you that I don't know the answer, but let me do some digging. So I've done that numerous times. If you ever have a doctor who says they know everything, maybe be nervous. But wonderful. Y'all have a wonderful evening. Thank you for joining me. I'll be back next month. So we'll be back the last Wednesday in July, and we'll answer questions. Y'all will be hearing a lot about sleep and recovery over the next month. So if y'all have anything on that front or you've tried anything, please let us know as you start working to kind of implement the sleep method. Remember that. Get that schedule there, get the lights down, really start getting your environment tuned in, add a few enhancements in there, and then right before, pause, just let everything kind of relax. Do a little journaling if you need to, if you got the brain running on at a high gear. Just get all of that out and you'll sleep better. You'll definitely sleep better. So thank y'all. Have a great evening, everybody.